Testosterone levels are 50% what they were 50 years ago, dropping by about 1% a year. That affects fertility. It's true of women too.
Some of these chemicals like phthalates and BPA are endocrine disrupting chemicals and they disrupt our hormones. But I was surprised when you said that microplastics can actually affect our hormones as well.
The plastic presence is its immune response. That immune response is going to affect hormones. It'll get in there and it'll affect thyroid. It'll affect testosterone, estradiol production, just because of the inflammation and the cytokines and the chemotaxis that it causes to happen, that just the body just cannot operate in that constant state and do what it's supposed to do. It's a metabolically expensive process an immune response is. And when it's going on all the time, it's no wonder you're beat. You're just fatigued.
Layne, thank you for joining me. I'm sorry I stalked you and finally pinned you down to do this.
Oh gosh, it's my pleasure. I appreciate being with you today.
Yeah, thank you so much. And I've been following you for a very long time, and I've learned so much from your Instagram channel and about hormone disrupting chemicals, environmental toxins, and there's so much depth of knowledge you have in this field. And I really appreciate you bringing this to the forefront of my consciousness. It's been
an interesting ride. Maybe I'll just tell you a little bit about how I got into this.
That's what I want to know. Like, you're a pharmacist. How did you go down this rabbit hole?
Yeah, right. Well, I've been in the hormone therapy area, specialty area, for most of my career, actually since my internship, so the whole time. And I just chose early on to get deep into the clinical side so that I could support patients in the same way that their practitioner was, prescribing things and the same course and program he had them on, he or she. So that really helped. And then patients started coming to me first because they kind of don't know where to go these days for hormone therapy. There's a lot of misinformation out there, and some of it's from old studies that have been debunked, or the interpretation's been improved. Let me put it that way. So they would start coming in to me. Where do I go? How do I get help with this? And so I kind of start with them, do some screening, and then I started seeing younger and younger people come in to my office, starting, they're looking for help. Their doctors didn't know really what to do with them. And so I'm thinking, what's going on here? I mean, hormone therapy, generally people think of that as sort of a middle-aged kind of issue. You don't deal with that until a little bit later on, menopause for women and, 50s or so for men. Not what I'm seeing. So then I started looking into it a lot more, and then I've come across this research on hormone disruptors. And to me, there's something going on that I think is environmental, because nobody else has any good answers for it. And so I started posting about that, and the followership just skyrocketed, which told me, that made me happy, because when I looked at the age of who these people were, they're in that 30 to 40 range, and I'm going, okay, this is making sense now. This is corroborating. There's a real issue here, and these people aren't getting answers. So I just dove into it deeper and deeper, and that's how I got into this. But it's been really, really interesting.
Really interesting. And it's so concerning, because I don't think a lot of people in their 30s, and I was one of them, I'll be transparent with you, that I was in my 30s and I was feeling horrible. I had very low energy, lots of symptoms, and I did not even think it could be my hormones until I was 40 and I got a testosterone test, and I saw my level was 200 something, way lower than it should have been for someone my age. And even myself, I just wondered, like, how could this even be possible?
Yep.
And it's very concerning, because now even in my practice, I see this over and over and over again. Testosterone levels, men and women, just being in the dumps, and also thyroid levels, et cetera. And it's a real problem, right?
Oh, it is. I'll tell you, this will blow you away. The youngest that I've seen with the lowest level was an 18-year-old, barely 18, This is an athlete. And that's what I'm seeing.
Yeah.
I'm seeing typically, these aren't couch potatoes.
No.
He had a total testosterone of 26.
Oh my gosh. Wow.
Yeah, and to give you guys an idea, we're looking at a young man like that. It ought to be up in near 1,000.
Near 1,000, right?
That's what I'm seeing.
26.
So these testosterones in the tank. I often see these younger men when they don't know until they come in and they're having fertility issues.
Right. Right.
Men are
Fertility
just
issues
not.
brings it up now.
Yeah, we're not in tune with our reproductive health. Women have a monthly reminder of what's going on. Men,
Right.
we don't look at it.
No. And we just kind of live with the symptoms and just assume it's,
Yep.
us being tired, weak, stressed, whatever you want to call it. And we don't deal with it or even check for it.
Yep.
It's just, and just so people can understand, someone might be listening to this and thinking like, is this a problem that I'm experiencing? What are some of the symptoms that you see that your clients came in with and were complaining about?
Well, for these younger guys, often it's fertility.
Yeah.
They're just not able. And traditionally, we blame the woman for that.
Right.
And that should be a big eye opener for people. Men are responsible for probably more than half of miscarriages. Just poor sperm quality, poor DNA fragmentation, low sperm count, low concentration, poor motility. But they don't know. They just don't know this because they can't feel it. So I would say that fertility, and then as they get older, they'll find that they're just less responsive anabolically in the gym. These guys are trying hard. Now, this kid, I tell you, I said, you have my utmost admiration. You're out there doing this against all the odds and all of a significant disadvantage. All the other athletes out there, I'm assuming, have near normal levels, and you're doing this still at such a low level. It really is hard. They get fatigued easier. They just don't get a muscular build response to disciplined exercise and resistance training. Cognitive things, loss of drive, just motivation. Testosterone makes you want to go out there and do the things that you enjoy doing. And so you're fighting that as well as the physical side of it, lack of response. And it's no wonder most of these guys just give up. And as you said, they just live with it.
Right. One of the things I find also with younger men in particular is, I think as we get older, we look as erectile dysfunction as a sign of low testosterone. And that's usually what alerts a man in his 40s or 50s to go seek therapy or treatment. In the younger individuals, I find that that's sometimes not part of the symptomatology. And some of the other things that you're talking about, fatigue, inability to put on muscle, weight gain, and that is kind of preserved. And, when I talk to these younger men about low testosterone, like, everything's working fine down there, doc. Like, I don't know what you're talking about. And I often have to tell them that is sometimes preserved in younger individuals.
Yeah. Yeah, you're right. We don't often see that, which is what most people would expect. Sometimes we do, but it's amazing how different it is in a younger man than someone that's older, because you got other, circulatory issues that are not as healthy as younger men. Yeah. But that's not always apparent from that perspective.
And the cognitive and the mental aspect is sometimes the most prominent, because these young men are often depressed. They often are doing poorly in their schoolwork. They're just not. They can't pay attention. I think sometimes they get labeled attention deficit as well. And so these are some of the symptoms that I think if you're younger, looking at your testosterone level could reveal the answer.
Yeah, for sure. And I'm glad you brought up the psychological things too. There was a psychiatrist that I knew years ago that said, I won't even consider psychotropics or any psychiatric medication until I look at testosterone. Oh, how I wish more of them were like that, because it could be such an easy either rule out or fix.
Yeah.
And how much better is it to just give something that you normally have rather than introduce something that, everything's got its baggage.
Yeah. Side effects and
Hmm.
psychotropic medications, et
Oh
cetera.
yeah,
Right. Right.
they end up introducing something else, and how more how better treatment, how much a better treatment that would be if they just looked at that. I call them foundational. Hormones are foundational.
Mm-hmm.
You've got to make sure that's there, and it's amazing if you bring those up to optimal, how many things just evaporate and go away. It's not
Yeah.
a fix-all, no question, but it is a bigger issue. And it kind of gives back to what we were talking about at the beginning. We don't have any answer for that. I really like thinking about root causes. I hate throwing drugs at things. I tell people I'm a recovering pharmacist. I don't really like drugs.
Right.
If they're needed, they're needed. But I tell you, there's a proper way, stepwise, to approach this, and
Yes.
it ought to start with that.
Exactly, exactly. So true. And you said that you came down to the conclusion that the environment was somehow leading to these endocrine disruptions, these hormonal issues. Can you kind of expound on that? What were some of the environmental causes that you were seeing causing these symptoms to occur?
Sure. um, I would break this down with these patients. Some of them, a couple of them were professional athletes who would go through back to their childhood, back to puberty, talk about what possible injuries, what was the timing of puberty, how did this progress, and I'm not an endocrinologist. I'm not even a diagnostician, but it helps at least to screen these people to try and identify if something is going on, then send them to the right place. But I would be seeing these things, and there just isn't a clear reason or a clear answer. So I got into the research of Dr. Shauna Swan. She was one of the first people that I read in depth. She's an epidemiologist,
Mm-hmm.
and she's done amazing research with phthalates. Phthalates are present in, they're a plasticizing agent added to plastics to make them more pliable and to improve the properties in whatever direction the manufacturer needs it to be. But they don't bind to the actual components of the plastic. They're just sort of free floating in the matrix. And so as such, they can readily off gas or leak out into whatever medium they're in contact with. And that was that was just really eye-opening to me, the things that we know about that and why that isn't more widespread, that knowledge, especially with pregnant women. Oh my gosh, there's a window of opportunity right there that most women don't have no idea. If they get exposed to high levels of phthalates, they're going to affect, if it's a male child, they will affect his progression and formation of genitals, even his fertility, that can pass on to his progeny.
Wow.
Because it affects germ cells. Only a short period of time when this is taking place, and there are changes in the brain that are affected, but the formation of the differentiation of genitals between men and women occurs at that window. And
Mm-hmm.
wow, that's something that would be an easy fix. I mean, as long as there's some education around it. So phthalates were one of the first things that I was introduced to, and then as I got into more and more of this, there's this little world out there, people that do this. I realized how many other things there are and how many different ways they can do things and how cavalier we are about it, especially in the U.S. It's like the motto for most of Europe is, prove it if it's safe. And it's kind of flipped here in the U.S. It seems like, and it's on to the consumer, and it's proved that it's harmful. Wow. So that lets a whole lot of things onto the market that I'm not saying that these people are necessarily nefarious in what they're doing, but I will say full-throated. They are careless and not
Irresponsible.
looking at what this could be possibly doing to people. And so that kind of approach leads to all sorts of things that we just don't have answers to. Testosterone levels are 50% what they were 50 years ago, dropping by about 1% a year. That affects fertility. And it's true of women too.
Uh-huh.
So
Yep.
somebody's got to have an answer here, but nobody's coming up with it. So
Yeah, it's mind-blowing. So these phthalates are chemicals that are added to plastics to give them certain properties. And these have never been tested. They've just been thrown out there to the public. They're ubiquitous. They're in everything now because they've been in plastics for so long, and plastics are everywhere. What are some of the other chemicals that are kind of mixed in with plastic that people should be aware of?
Well, most people have heard of BPA, bisphenols. There's that class. There's the polyfluorinated alkyl PFAS. Those are, talk about ubiquitous. They'll do samples and tests on. They did one on breast milk in women. 100% of those tested had PFAS in the breast milk. It's in the water. It's everywhere. And these are things that waterproof, like waterproof clothing, stain-resistant carpets, or furniture, raincoats, fire retardants, those kinds of things. Takeout boxes, pizza boxes, so that the grease doesn't soak through the pizza onto your upholstery in your car. That just gives you an idea of how they get to be everywhere. And so, yeah, those are a couple of others. And then, of course, plastics, microplastics.
Yeah. So plastics come with chemicals added to them that have severe effects, I think, not just hormones, also to your immune system, to cognitive function. There's a lot of effects to these that have been shown in studies, but also effects that we don't even know coming from these chemicals out of the plastics. And then the plastic itself can also be an issue. And we're hearing a lot about microplastics. You're talking a lot about microplastics. I'd love for you to kind of maybe just first define what is a microplastic and how are these all over the place, and how did we find them?
Sure. Well, let me just tell you, there's a couple of kind of interesting factoids about this. This may catch people's interest. The calculated exposure dose of microplastics from plastic bottled water was 22-fold higher than that from tap water. Now, I recommend filtering tap water, and we'll get into that a little bit later. But then there was also a study in France, out of France here. I think it was a Journal of Food Composition and Analysis, just like last month, where they found it. They tested some beer, they tested wine, they tested soft drinks, and I think water, and they found it higher in glass. So that kind of, because there's been all kinds of studies that show it higher in plastic.
Right.
Well, and on examining it further, they found it was from the paint on the lid.
Yeah.
It matched. So anyway, that's just a little interesting aside.
Drinking
water.
That's an important point, because just because you're drinking out of a glass bottle doesn't mean you're safe now, because
That's right.
the lid is a problem, right?
Yep. Yeah, I know. It's just like we come across that all the time. Oh my gosh, now there's this we have to worry about. Now there's this. But
So
you've got to think that way.
Yeah.
You got to think critically.
You have to think critically about everything that you're putting into your body, and what is being housed in and stored in as well.
Yeah. So interestingly, drinking water and beverages are second as a source of microplastics to the air we breathe. We get more exposure and more microplastics in the body as an entry point through the air we breathe than what we drink. I thought that was interesting. And it's important to note here that in animal studies, I'll qualify that, microplastic exposure has shown that there's a link to inflammation, there's a link to immune response, hormone disruption, and metabolic, so lipid and energy metabolism. So those are there. And evidence is emerging that we're seeing that it's also coming up as an obesogen. In other words, making us resistant to weight loss. That's That's something that is interesting when you look at charts. You'll see that obesity and the introduction of plastics kind of track along together. You go back 50, 60 years. Just saying, there's a lot to this. So microplastics are these materials that are broken down. Microplastics considered down to 0.1 microns. And to give you a reference, a human hair is about 70 microns. A nanoparticle is anything below that. So that's a definition of microplastics. If you think of plastics like as a mineral, let's say gold, for instance, and gold's a good example because it's soft. It will over time. I mean, if it's sitting buried in a vein under 200 feet of soil, it's going to stay just as it is. If it's rolling down a creek bed, it's going to break off these little microparticles, and pretty soon it's dust. It's gold dust. It never goes away, though. There's a finite amount of gold on this earth, and the comparison to microplastics is really good here because they similarly will never go away. But the big difference is we can make more, and we are, by the hundreds of tons each year. So just think about that sort of accumulating. That's what we mean when we talk about microplastics.
So these microplastics are 0.1 microns, and anything smaller than that is a nanoplastic. And so microplastics, they can go all the way up to a millimeter. Is that correct? Is that?
Sometimes they're bigger than that. It's absolutely shocking. The size that they'll find sometimes, like in the gut.
That's crazy.
Like embedded in the wall of the gut.
I mean, you can see these sometimes in the gut. I've seen pictures of arteries where they're in the artery as well. But how small does it have to be for it to get absorbed into the bloodstream? And how does it kind of affect where the particles end up in your body?
Okay, good question. When they're smaller, a nanoparticle, it impacts things in a number of ways. One, they're more reactive because there's more surface area. So the charges and the characteristics of that particle now can interact more. Another reason is they can penetrate biomembranes, like they can penetrate the blood-brain barrier. Nanoplastics, like at 0.1. It takes... It can absorb through the alveoli in the lungs at 2.5 microns.
Wow.
In the stomach, 150 can be absorbed. Looser junctions in those cells. And obviously the more particles you get, so in nanoparticles, they're going to be spread out more in the cell, on the earth, in the wind. This is why they're everywhere. They've been found in the Arctic snow where man has never set foot. That's how they get everywhere. They're just teeny tiny.
They're tiny and they just go everywhere. And in our body, I mentioned that I saw an article where they had done a dissection of a artery and they found microplastics in the artery wall. Where else do they end up in our bodies?
Oh gosh, they're in the blood clots, breast milk. In large abundance, because they prefer to be in the plasma. That's where they circulate around, in the plasma.
Oh, okay.
Semen, testicles, lungs, heart, brain, carotid artery plaque, right here. And that's a common test for assessing cardiovascular risk. You know that they found that patients they found plaque lodged in that plaque were found to be 4.5 times more likely to have a cardiac event in the next 3 years. So there's not a lot of data out there that show the effect. That was a human study, by the way.
Yeah.
That show effect on humans. And so a lot of people kind of dismiss it that way. Peter T. is a little bit that way. Well, we don't have good data. It's hard to measure. And he's right. It is hard to measure nanoparticles in the human body, especially in tissues. But when you've got anything like that circulating around, and if it shows risk like it did in the carotid artery plaque, I don't know I don't know why we would wait. You're not going to get really good studies because what are you going to do? Introduce somebody with microparticles or nanoparticles and say, we want you to be in this study. You might have a dose of nanoparticles in it, which could cause some problems for you, but we need to see how you do compared to someone who doesn't have it. Sometimes all we're left with is epidemiological studies. And we can look at like urine levels too, and that can help. So it's hard, but I hate dismissing it because, well, we don't have a lot of good data yet. We have things that are like it. And we talk about those for a second. My gosh, it's not without precedent to have what they call a persistent inert substance in the body. Think about coal miners, black lung.
Right.
That's carbon. That's inert. That's not going to dissolve and break down. So what happens is it gets in the lungs, and it's in small enough little dust particles that it can get into the lung tissue, the alveoli there. Think of those as like a bunch of grapes with a lot of surface area. About 90 tennis courts is about how big the surface area of your lungs is. So that gets in there. The immune system recognizes that. Well, it doesn't recognize it. It says, we don't know what this is. So you need to leave. So it does its macrophage thing and surrounds it and tries to isolate it and digest it, but it can't because enzymes don't work on it.
Right.
So it just keeps circulating around. It's working and trying, and the whole time it's creating inflammatory responses and trying to recruit everything it can to do it. And then finally, it just says, all right, well, if I can't get rid of you, I'm going to isolate you. And I'm going to build a cocoon around you and just make it so you can't do anything and we can't do anything. Nobody can do anything with you.
Yeah.
Well, so it sits there in the lungs and forms fibrosis, scar tissue around it. Well, that's black lung disease.
Right.
We see it with asbestos. We've seen it with silicone, silica dust, rather, not silicone, silica. That's volcanic ash, things that are minerals like that. So it's not without precedent. Have we seen this kind of inflammatory fibrosis formation with microplastics? I don't think so. I don't think we've seen it yet. But should we wait?
Right.
I think the stakes are pretty high here.
Yeah, absolutely. I mean, and you provided me with a nice chart kind of comparing these, and I'll put that chart in the show notes, carbon and silica. And if we assume that our body, I mean, we don't have to assume this, we know this, that our body does not recognize plastic as something that is supposed to be inside of our body, it's going to have a similar response, this inflammatory response, which also leads to cancer, right? An overactivation of the immune system can lead to cancer as well. It's going to have a very similar response to that we've had to carbon, is your point, in coal miner's lung. And so why wait to accumulate that level of plastics in our body before we start trying to avoid it, correct?
Avoid it or do whatever it is that we can do. There's several approaches to that, but yeah, absolutely. I mean, one of its effects on hormones, maybe we could talk about that for a second.
Yeah, I'd love to. Before we do that, can our body eliminate these microplastics? Does our body have mechanisms to eliminate the microplastics?
Well, it does. They're not very efficient.
Right.
And so as such, you can have these particles circulating around for really long half-lives, months to years. And the reason for that is because, how does the body normally eliminate these things? They get surrounded or tagged by the liver with an aura or something that helps the body recognize it as, we want this out. The liver, after doing that, dumps it back through the bile duct into the GI tract, but it can be reabsorbed. Is the problem. It's so small that it can be reabsorbed. So some of it is eliminated that way in the stool. Some is eliminated through the kidneys. But again, you can reabsorb through the kidneys as well. It can filter it out and then reabsorb it back in, and that's what happens. Other than that, the macrophages they don't have an effective enzyme to break it down into, there's these long polymers. You can break it down into its constituent parts. It just We don't have it. So it tends to be in the plasma when it's circulating. And so the ways they say you can get rid of it are you can get rid of it by giving blood or menstruating, same idea.
Yeah.
You can, by giving plasma, that would be even better because that's where it kind of focuses in the,
Right.
or wants to be in the bloodstream. Or plasmapheresis.
Yeah.
Have somebody actually wash your plasma or remove it. These things tend to want to grab onto proteins in the plasma, like sex hormone binding globulin, for one, and all sorts of others, albumin. As you're aware, I think you have some of those in your clinic.
Yeah.
I don't know that any of these are really sustainable.
Right.
They're expensive, some of them, and you can't give blood, regularly.
Yeah.
Without
Not
some
regular
effects.
enough to eliminate all this stuff. I mean, we do plasmapheresis in our clinics, and yes, it does eliminate all the plasma, and the microplastics being in the plasma is eliminated. But how often are you able to do that? The expense, the time. I think we'll go over solutions a little bit later, but before we do that, I think, one of the things I was really surprised by is I understand that some of these chemicals like phthalates and BPA are endocrine disrupting chemicals and they disrupt our hormones. But I was surprised when you said that microplastics can actually affect our hormones as well. So I would love a little bit of clarity of what's the mechanism of how microplastics affect our hormones.
Okay. Well, actually, it's very much related to those plasticizers, the
Okay.
phthalates and
Got it.
the BPA and PFOS and things that come in sort of as stowaways. So now this is where the surface area becomes critically important.
Yes.
I don't know. This is my own thinking. I haven't seen anybody address this, but it stands to reason. Think about a ball, say this size. Say it's I don't know, like a croquet ball or something like that. And think of the surface area of that ball. Now think of if I have that same ball, the same mass, but in 1,000 balls, it would fit in that same space.
Area.
That surface area goes up exponentially.
Yeah.
That means you have all that much more disruption or hormone disruption or chemical exposure to the outside from that surface area. It just exponentially multiplies it. So that's a big concern and issue for me. At the other side of it, just from purely plastic, the plastic presence is its immune response. That immune response is going to affect hormones. It'll get in there and it'll affect thyroid. It'll affect testosterone, estradiol production. That just because of the inflammation and the cytokines and the chemotaxis that it causes to happen, that the body just cannot operate in that constant state and do what it's supposed to do. It's a metabolically expensive process an immune response is. And when it's going on all the time, it's no wonder you're beat. You're just fatigued. So that's what I have for you on that.
Yeah, no, that's an excellent explanation. And I think, Layne, it can get overwhelming for people listening to this, that there's plastics everywhere. They're getting in through every hole in our body, and it's causing all of these problems, inflammation and hormone disruption and obesity. And I think there's a tendency just sometimes throw your hands up in the air and say, well, I can't do anything about it, so I'm just going to keep drinking out of plastic bottles. And so I think you and I are both very solution oriented here, because there are things that people can do that can reduce their exposure exponentially. And I love the way you kind of frame this. Like, what are the entry points of microplastics into our body? And how do we, knowing that those entry points, how can we mitigate our exposure? And once you mitigate your exposure, you're way out of the game on the problem here, right?
No, for sure.
Yeah.
You got to be, I hate being the chicken little guy that's running around saying the sky's falling, and just get everybody in a panic. And it's like going to a movie where the hero dies. Nobody wants to go see that show. And I'll tell you, there are things that can be done, and it's important to know what those are so that you can feel like, okay, I can do one of these things. I can do that. I can do that. I can remember that and do it when I can. That's what you've got to do. But when we're talking about things in the kitchen, for example, or something as simple as takeaway containers from fast food outlets that are styrofoam. Okay, heat, styrofoam, oil, not a good mix for leaching things out from that container into. So take some glass containers and just keep them in your car. So when you go and you get takeaway, tell them, put it in this, would you please? Keep your container and just put it in this, and then you've got it in your car in glass. That's a quick and easy little swap thing you can do.
Yes.
Don't warm up anything plastic in the microwave. That increases the things that increase the leaching are heat, friction. What else? Of course, the nature of the type of plastic resin. There are better types than others. So yeah, opt for glass containers or stainless steel in the kitchen. Wooden cutting boards, not plastic. Just think about, all you have to do is take your knife and run it edgewise across the top of your, onto a black piece of paper if your cutting board's white, and just look at the particles. Yeah. That's just what you can see.
Right.
That doesn't take a $1 million study to show you. I'm eating that.
Yep, we all have.
It's connected to my food that I'm eating. I was going to bring some from down in my kitchen and I forgot. Sponges. You can, rather than, the sponges that are yellow and then they have that green abrasive layer on the one side, you can get them that are made from ground up walnuts.
Oh, really? I did not know that.
Yep. And so just little things like that, when that's going to reduce, I don't know, some people scrub vegetables and stuff with them, but most people do dishes with them. But it'll also reduce the plastics you're dumping into the water. Okay, so there's a couple of ways to think about this. You've got to think about yourself, and then you've got to think about the bigger picture and preventing continued being part of the problem. Sort of like being in a driving rainstorm. If someone were to tell you, now, you get wet, you're going to stay wet for 2 years. And you're going to be all panicked, and how are we going to stop this rain? How are we going to, no, you've got to worry about getting an umbrella. Okay. Let it rain over there. You can't do anything about that.
Right.
But you've got to stop the exposure to yourself. And unfortunately, that's where you have the most control, your own micro environment in your kitchen. There's, we talk about clothing as well, or things in the house. When you look at, we talked about air being the primary source.
Right.
Well, you are too. Everybody's done this. Take one of those real high intensity flashlights they make these days. You can really zero the beam in and just walk into the room and look at that in the air. You get what you see there. I've done this before and after running my HEPA filtration too, by the way, and it's dramatic. Okay. It's dramatic. Wow. That's what you're breathing. And where does it come from? Well, somebody will say, well, we've had dust in the air for millennia. What's the problem here? The problem is, in your house, that used to come from all natural fibers: cotton fiber, wool, linen, bamboo, things, things that are natural and the body can do something with.
True.
But when it comes from your couch, from your drapes, from your carpet, from vinyl plank flooring, all of these things, and your clothing, throw it into the air, and then it settles into dust around your house. All of that stuff, this is why you have to filter the air in your home. So that would be one of the main things that I would leave with people, is you've got to keep that air clean with a HEPA filtration system, which will take out won't take out necessarily all nanoparticles, but most of what's in the air is micro, honestly. Right. So it'll take it'll take down to 0.1 microns, the HEPA filtration system.
Yeah.
So that's important.
That's a really important point. And then what about, I think about the particles in the air, and like you said, like you run around the flashlight inside and you can see all the particles in the light beam. What about just even opening the window?
I think that's good because honestly, the air outside is much cleaner than what's inside.
No, exactly. People
It
don't
is.
realize that.
Yep.
In most places, the air outside is cleaner than it is on the inside. Maybe not in New Delhi, but in most other places.
Oh, here's another really easy hack, Dr. Shaw. If you take your furnace filter, the
Yeah.
chances are you're using one that is less efficient than you could be. You see them, they come now in like 4-inch sizes, and a lot of furnaces now have a big slot for you to put that filter in there. So get the biggest that your furnace will tolerate, and you have to look at the specs because you can burn up your blower if it's too big or too much for your system. But buy one that has a carbon filtration component to the filter. That will catch 95% of hormone disruptors in the air. Now, it's still not as good as a HEPA filter, so I still advocate those throughout the house. HEPA filtration, you got to keep circulating that air through those HEPA filters. But that's an easy one, and they're not that much more expensive than regular filters. In your car too, cabin filter in your car. Get a carbon one that has carbon in it.
Okay. That's great advice. I have not done that actually, and I think that's. I have a air filter in the room that I sleep in. My kids have an air filter, and we also and then we keep the windows open in the living room and kitchen for the most part, but at night we close the windows. And we use one called Layne Air, which is really good. But it's something, it's an investment, right? I mean, but I think it's a very, very good investment because it's not just the microplastics and the chemicals. You're filtering a lot more out of the air. And what I tell people is, where do you spend the most time? It's in probably your office where you work and your bedroom where you sleep. Buy 2 air filters for those 2 areas, and then you've cut out a lot of the problem.
Yep, absolutely. And there are things to look for. There are certain brands that I like. I don't know. I like the Allen brand. I don't have any connection with those folks, but I've done reviews on a lot of these different systems, and I also like people to understand what are the factors that I take into consideration here.
Sure.
One, it's got to be HEPA, of course, HEPA filtration. It's got to have a carbon component in that because you can get HEPA filtration without activated charcoal is another way of saying that. You want to look at the price of those filters because that's your consumable. That's your ongoing expense. You want to make sure that it's not too loud. That's another factor that makes people not use them. I can't stand the noise. Okay. You measure the decibels. I mean, usually if they don't say what that is, then ask them. Those are all important factors. And that it's big enough to handle the cubic foot area that you're expecting it to clear. I like that. With Allen has these different models, and they're not expensive, really. I mean, I don't know, a couple $100. There's a range, obviously, because there's small and then there's the bigger ones. But make sure that it's adequate. You're not overworking it, and then of course change your filters regularly.
Yes.
Don't be the guy that goes in there after a year and you go, oh, crap. This was in my air? Yeah. And it still is now, dude. Replace it.
Well, one thing that we forgot to talk about was the solution on the water that we're drinking. How do we get our water cleaned of the microplastics and these chemicals?
Very good question. You got to filter that water, and it doesn't matter if it's from a well or it's from a city source, wherever it's from. You've got to have a reverse osmosis system. You could also you can also use distilled. There are systems that use that, but they're a little more tedious and there's a little more to them. But the most easy, convenient way is to use a reverse osmosis system that you can install under the sink, has its own dedicated spout. You want to get one also that I think the better ones are tankless because then it's not sitting there being stored in plastic.
Right.
and then you want to get some good food grade silicone tubing rather than plastic tubing as well. And then you also want to add minerals back. When reverse osmosis, it takes everything out, including minerals that are healthy and that also make the water taste better. So you want to there's a filter like at the last that adds that back in, and you want to get one that's got that too. But yeah, that's really important and critical. You cover water and air, you're good.
Yeah.
I mean, we got to look at good enough here sometimes rather than perfection.
Yeah. Yeah.
And that it helps people also not to get lost in I can't do this. This is just overwhelming.
Right. I
This is
completely
exhausting.
agree with you. Right.
Yeah.
I think some of it just doesn't cost any money too. It's just changing your thoughts around, opening the window versus keeping the windows closed all the time in your home. That doesn't cost you anything, but it's just a mindset to get into about avoiding toxins, avoiding microplastics, and just being more mindful about it. I think it's important. But some of these things cost money. But I just looked this up today. You can get a desktop reverse osmosis system with a remineralization cartridge for $200 now. And just putting one of those at your work and at your home, if you don't want to spring for the reverse osmosis under the sink, could be an alternate as well. However, I did find a $200 under the sink reverse osmosis system too, and I think a plumber would probably charge $150 or something to install that. They're not difficult to install.
Yeah,
it's not a big investment for a big outcome, right?
Mm-hmm. Oh, for sure. And I would say too, be careful because what tends to go down with price is the speed that it filters. So look for that and make sure it can be big enough for your family. If you're just one or two people in the house, then it's different. But yeah, you can often get away with spending much less just because it takes longer to filter, a certain amount. So you want to maybe put some in the fridge in a pitcher, or accumulate some if you're having guests for dinner or something. But yeah, that is one factor that will affect price. Yeah, but yeah, you got it. And you can even buy these things that are portable. You take with you when you travel.
Yeah.
They're
And
not
then,
terribly expensive.
so we got number 1, which is air. Number 2 is water. Number 3, I think we mentioned, is just the plastics in our kitchen, right? All the cutting boards and the plastic storage containers, getting rid of all of those. And the way I look at those is a lot of these are just one-time replacement costs, right? You get rid of your plastic stuff, you buy the wood and the glass, and then guess what? They're reusable. And so you can use these over and over again. I think one place where plastic sneakily enters into our life is the so-called paper cup that we get served our coffee in. Talk about that a little bit.
Oh, yeah.
And the paper straws too. I just read this today.
Well, tell me what you read. I'm curious.
Yeah, I mean, it seems evident now that I think about it, but the reason water or a fluid can flow through something that's paper and not disintegrated is because there's some plastic lining in it.
Yeah,
and the paper straws have a coating on the inside that allows it to last longer. And the same with paper cups that you can find at your local Starbucks, and they serve you this hot coffee and that's leaching microplastics, leaching chemicals into your coffee.
Yeah, exactly. I was wondering if you were going to tell me something new about something that makes it stronger. But yeah, those things that keep the water. They're a water barrier, so they're going to be some sort of PFAS probably to make it be water resistant. It's the same thing with cans, believe it or not. A lot of cans have linings in them, especially if the contents are acidic. And lots of things are these days. Sodas, even tomatoes, vegetables, those are pretty acidic. It used to be BPA that a lot of places used, but now a lot of them have taken that out. But here's the thing you have to watch out for. There's this, what do they call it? Greenwashing.
Yeah.
People, they know they have to address this because it's getting increasingly important to people. So yeah, we're BPA free. We have BPS in there, but we're BPA free. And so, okay, well, there's a term in the industry that they call regrettable substitution.
Right.
Wow. Really? We didn't realize that BPA does the same thing that BPS does the same thing BPA does.
Well,
Really? you didn't look at the structures of these things. I mean, just the structural activity relationship there is it's not even deep chemistry. They look the same. They're probably going to do the same. So you got to watch out for that. I just try and avoid. You can't always, but I buy in glass containers whenever I can, and obviously buy fresh whenever you can. So the other thing for food is buy organic whenever you can, and whenever you can, make it be domestic organic, not foreign, imported. They're not the same standards. I could do a whole talk on this, but also, if you can avoid things that are wrapped in plastic, you can't always. And listen, don't everybody go and be depressed all about that. You do what you can, but as you know and understand what factors into this, you can go, all right. Well, I know there's a farmer's market on Friday, every Friday afternoon. I may just go there. You're not going to get wrapped in plastic there. You may not get organic, but to me, just as good as you sit and you have a conversation with that farmer and ask him what his practices are.
Yeah.
A lot of them just can't afford the seal. They can't afford the organic seal, but they're conscious of it because that's what people go to a farmer's market for. Yeah. So as you know these things, you begin to do them when you have the opportunity and as you can afford it.
Right, exactly. Your whole point about BPA being replaced with BPS. Have you ever seen John Oliver's segments on PFAS?
No, I haven't.
Oh, Google this. John Oliver has a show on HBO. It's a comedy show where he reports on real news using comedy. And he's done a few segments on PFAS, one back in 2021. He did an incredible segment on the industry and how they literally, there's so much corruption in this industry of chemicals and how it's spewed out into our environment. And he's done a really good job talking about it. I'll send you the link later, but you can just Google
I'd love to see it.
John Oliver and PFAS. And he's done 3 or 4 segments on PFAS and just how ineffective our government is on dealing with it, how the regrettable substitutions happen, as you described them, is just the chemical industry's way of tricking us into thinking they're doing something it's just really a circumventing the regulation. It's just mind blowing, and I think each and every one of us need to become aware. We need to take matters into our own hands and protect ourselves from these. And I love your umbrella analogy. Yes, this stuff is everywhere, but if you have an umbrella, you're protecting yourself from most of it.
And that's where you start. You got to, first things first, okay? Do what you can first, and then you begin to work on these other bigger things as you can. You're not going to be able to go clean the Pacific Ocean of that plastic raft that's supposed to be floating around out there somewhere. Right. But you can protect your family. You can protect your home. It becomes another phrase in this circle that I move in is called precautionary consumption. And to me, that goes right along with my motto at Hormone Specialist of gearing you up to tell the world, I decide. You cannot outsource blindly and without thinking anymore and think that somebody's looking after you and has got your back.
Yeah.
No, you've got to assume that they don't. And if you see an ingredient list with you need to take a nap before you finish reading it, then there's probably some issues there. You might want something simpler. Glass containers, metal lids without paint. We just changed our omega-3 fish oil to metal caps. So the timing was perfect from this study, but without paint. Yeah. Just you start thinking about these things and realizing, I hate to say it, and this is the kind of discouraging part about it, is you just can't trust anymore.
Yeah.
Corporatization of all of these things have made it so that you understand they have to look out for shareholders' interests and their bottom line profit. But they can't discard your health. And it's never been a better time. I love seeing these grassroots small businesses come and putting these clean things on the market and doing really well. I love seeing that.
Yeah. No, it's so true. It's amazing to see people finally taking matters into their own hands and really just, like you said, stop outsourcing your health to government organizations that really are hobbled and can't do much about it. So,
hey, if I can, but
yes.
I did forget to mention when we talked about water filtration.
Yes.
You really ought to when you're looking into the one you're buying, make sure that it's rated for removing PFAS,
Oh, okay.
because it's not necessarily whatever NSF code that it has. It doesn't necessarily include that unless they say it. So you'll want to do that because you're going to spend a few $100s for this. So make sure it does everything you need it to do. I forgot to mention that.
Oh, I'm so glad you mentioned that. Yeah, thank you.
Should I
Wow.
mention a brand that I've used? I don't know if
A brand of water
that I've
filtration?
used a filtration system. You
Yeah.
can take it out if you want of this, but I use Water Drop.
Okay, no, I love
They
that.
have
I'd love to hear what you use. Water drop. You've
they've
done the
got a
research.
good they've got a good tankless under the counter, and you've got your variety of speeds. Like I need it to do this much in this amount of time,
Okay.
and they've got no plastic. Even the housings of the filters are metal. So these are all things that they're hard to find. I believe me, because I've looked and I've looked and I've looked. But I like those folks. And again, I don't have any affiliation with them. I don't. I
Thank
just
you.
like, a lot of people will ask, because it's exhausting out there looking for this stuff,
It
so many things
does.
to think
Yeah.
about.
I'm glad you've done the research for all of us, and we will put links in the show notes to all the recommendations that you have. Um, so just to wrap it up, Layne, this was an incredible deep dive into the world of microplastics, and I hope people take it to heart and really understand that they can do something about this. And from a 30,000-foot view, how do we view this whole issue? Just give us a summary.
Okay. I would say I'd like people to leave with 4 things here that they can do and will be the most effective at making a difference. The one is you got to filter your water. And we've talked about what kind of filtration system you need there, either a reverse osmosis or distillation, to get all those, bad actors out of there. Filter your air. We talked about that too. So water and air, buy organic fruits, fresh food whenever you can, as much as possible, and try and avoid the plastic wraps. Plastic wrap that you have at home, get some that at least say that they're bisphenol free. That takes out BPA and BPS.
Okay.
You can buy plastic wraps, stretch wraps that are better than others. Okay, so look for that. And then, you know what? Just try. This is the overall how I'd like to somehow impact the outside from underneath my umbrella. Try and reduce your plastic use, especially single-use plastics of bottles, Walmart flags. I call them that because that's what they end up in the trees. It's single-use bags like that. Just carry these things with you, even for your produce. And you have to get into the habit of, okay, I got to take my bags in with me and use that. But as you begin to think about all of those things, that's how you can make a difference for the bigger picture and feel better about yourself. And you do when you're doing that.
Yeah.
Carry those containers in your car. When you're at the restaurant, it's too late, and you got takeout. So carry those things so you can be prepared. It just takes a little preparation. So those 4 things: filter water, filter your air, buy organic whenever you can, plastic free, and do your best to reduce plastic usage whenever possible. Just think, is there something else I could buy that wouldn't be plastic? Because that's going to be around for your great grandchildren.
Yeah, absolutely. Layne, thank you so much. This was an incredible deep dive into the world of microplastics, and really appreciate all the knowledge you've given me and given us on this podcast. Where can people learn from you more?
So my my presence on social media is under Hormone Specialist, on Instagram, TikTok, YouTube. That's probably the best place to access my stuff. And I do regular features on toxins, on these hormone disruptors, how this can affect us, but also what can you do about it? How can you increase your protection and be more precautionary in your consumption? So hope that's helpful for folks. Seems to be a lot of people really started following when we started talking about that stuff. So there's some concern out there about it.
Absolutely.
Thank you for the
you.
invitation. I appreciate it.
I really appreciate you doing this. Thank you so much, and look forward to doing this again sometime. We have a lot of topics we need to dive into.
Let's do. I'd be happy and willing.
Great. Thank you.
Okay. Bye-bye.